Hi everybody, welcome back to yet another episode of Hair Talks by Terra Medical. Now this week, what we're going to be talking about is the difference between hair loss, hair shedding and hair thinning, and some people mix up those three things and we're here to clarify all that for you. So let's dive into it.
3, 2, 1.
So first, let's cover the topic of hair shedding. We first have to clarify that there is a baseline rate of about 50 to 100 strands of hair that will be discharged from your scalp every day. Now that seems like quite a large number, but that's distributed throughout 24 hours over the day. Most people will see this shedding in the form of hairs that come loose during the shower, during their shampoo process, when they're towel drying their hair or when they're blow drying their hair. That's not representative of the total number. Some people also see it ending up in the floor trap or see it on their pillow when they arise in the morning. Now if you take all these hair strands, including those that are intangibly lost, let's say during your working hours or when you're standing beside the bus and a gust of wind blows by, and you add them all together, that should number less than 100. So that's a normal rate of shedding that happens in just about everybody. People with long hair, like how I've grown out my hair, are going to see more hair strands that shed than people with shorter strands of hair. And that's just by sheer mass of the hair that you would actually notice. Now this is in contrast to excessive hair fall. Excessive hair fall can be difficult to identify. It depends on how observant a person is from their day-to-day shedding rates, and sometimes people also exaggerate the amount of hair shedding that they have, thinking that it's actually a lot. So what's more useful is to watch a trend in your hair shedding rate. So if you're used to seeing maybe 10 strands or 20 strands when you're shampooing your hair, a sudden increase to double the amount, 50 strands, 100 strands, just during the shampoo process itself can be an increase in hair shedding rate and is an important observation. It's not just the absolute shedding rate per day that's important, but also the duration of shedding that's important. Now some people have good days and bad days. For example, someone who was very stressed out at work or didn't wash their hair that day or just had poor sleep or just had a stressful time from their boss would have maybe an increased shedding on that one particular day itself. That does not translate to a prolonged period of shedding that would end up thinning out the hair. So it's more important to observe the trend of shedding and the duration of shedding. Now, if the duration of shedding has been sufficiently long, people will notice that the hair volume or the hair mass actually decreases. And when there's a decrease in hair mass, it turns out that more scalp will be observed, the ponytail will not be as full, or people will just find that, hey, my hair is generally not as thick as before. And that might have aesthetic implications, for which you should always consult a hair restoration professional to have it examined. And there are a few ways we examine this hair shedding rate in clinic. We use a trichoscope to examine the scalp and we look for hints and features on the trichoscope of your hair follicle roots. Sometimes we see a bluish tinge, sometimes we see empty hair follicles, sometimes we see hair follicles that have shed and just started to grow again, but they're too tiny to be seen as tangible hair strands. And we also do a pull test in clinic. So we pull at random areas of the scalp and we see a total aggregate number of hairs that have fallen. I don't recommend you doing this at home because if you're using the wrong tensile force, you might be actually pulling out hairs that were otherwise healthy. In terms of duration, you also will have some people who have differences in hair shedding from day to day. We call them good days and bad days, and sometimes it's worthwhile to note that down in the journal, like I'm having a bad hair shedding day today, and look at it over a period of, let's say, a month. How many bad days have you got in that 1 month? Some other folks have seasonal hair shedding, like when it turns hot in the summer in certain countries, or when it turns very cold and you're avoiding sunlight, you're hiding indoors, and then you have seasonal periods of shedding, and that also warrants some attention because sometimes that can be diagnostic of various medical conditions, for example, lupus. Some other folks experience a couple of heavy weeks of shedding, following which the hair shedding rate goes back to normal. They don't see a tangible decrease in their hair mass or hair volume, and that doesn't usually pose a problem. Now, when we talk about hair shedding, we have to talk about telogen effluvium as a medical diagnosis. Telogen effluvium is usually encountered by people who have severe acute periods of either physical or emotional stress. An example of physical stress could be that of a major illness, major weight loss from a crash diet, undergoing major surgery. Whereas emotional stress could come from a bad breakup, periods of heavy workload, or moving countries, moving houses. By definition, 10% of your hairs are in a telogen phase at any one point of time, which means that 10% of your hairs are actually not in your head, they're somewhere on the floor. Now, if this 10% number actually increases to 20%, 30%, or even 50%, that would mean that you have telogen effluvium. More of your hair follicles are in a resting phase and have shed out of your scalp. Now, this condition usually recovers on its own. Sometimes it can take 3 to 4 months before the shedding does reduce, and even longer, 6 months to a year before the hair actually grows back. There are ways to improve the outcome of telogen effluvium. Be sure to visit your hair restoration practitioner for a diagnosis before you commence treatment to see overall improvements, especially in the long term. Now let's talk about thinning hair. Thinning hair sometimes can be described by some of our patients as individual strands of hair getting finer over time. That could be due to aging factors, it could be due to the effects of DHT or inflammation on the hair follicle, causing a miniaturizing effect of the hair where they get finer by the strand. Or it could also refer to a patient just seeing more visibility of the scalp, less volume on the hair or less hair mass, as we talked about in our previous topic on shedding hair. So it's important when you're asking questions about thinning hair to find out what the patient actually means. This is always followed up by a very thorough examination. So it's not just using photographs or using your bare eyes to look at the scalp for areas that don't look as dense as others. It's also taking a 20 times magnification trichoscope to the scalp to look for hints of miniaturizing hairs, which could indicate male or female pattern hair loss. Using that same microscope at about 50 times zoom to look at any dysmorphia of the hairs, which means the hairs are misshapen, which could indicate a nutritional deficiency, and that's a video that we're going to get onto. It's also important to identify over which areas are thinning, because most patients will tell you, I'm thinning from the front or from the top where the light is incident, and that's usually the places that are first noticed. But what they don't notice, and is sometimes pointed out to them, is that the crown area, the vertex area is also thinning out, or some patients are even less mindful that the sides or the back or the donor region is actually thinning out as well. And this is something that trained professionals should actually be going through your scalp and comparing the hair masses between different areas of your scalp with a trichoscope to see whether or not the hair caliber as well as the hair density are consistent throughout, or has there been a differential hair mass between different areas, thereby pointing you into the correct direction in accurate diagnosis. It's worthwhile to note that by the time you notice that there has been hair thinning, 50% of hair mass has already been lost. It will be worthwhile at that point to consider various options to arrest the hair loss and to reverse the hair thinning. So there are various methods available depending on the diagnosis that your doctor provides to you. Now let's talk about hair loss. In the medical world, we term hair loss as alopecia. And there can be many different kinds of alopecia, including the more common varieties of androgenetic alopecia or patterned hair loss, or the less common varieties of chronic telogen effluvium, for example, where hairs diffusely shed from your scalp, which very much could mimic female pattern hair loss. There could be other kinds of hair loss, such as alopecia areata, where you lose hair just from various patches all over the scalp, or hair loss in general due to aging, that's called senescent hair loss, or hair loss due to being on certain medications or medical conditions that precipitate this hair loss, for example, thyroid conditions or medications such as isotretinoin or Roaccutane as it's more commonly termed. In summary, we have covered the 3 major complaints that patients would present to Terra Medical for: hair loss, hair thinning, and hair shedding, and how we're going to characterize each and differentiate each of them, as well as understanding that they could all point to different diagnoses. I hope this helped you have a better understanding about the different types of hair loss or different terminology surrounding hair loss, and we look forward to seeing you soon in our next episode. Thank you very much for watching this episode of Hair Talks by Terra Medical, and we'll see you next time.